Hello, so today I'm going to be doing my head to toe assessment. Um, Currently I don't have a human with me, but for the final video I will have a consenting human. So let's get started. So the first thing that I'm going to do is I'm going to perform hand hygiene. I'm going to knock on the door. Now I'm going to draw the curtain or close the door to offer the patient some privacy. So now I'm going to ask the patient what their name and their date of birth is. And I'm going to double check it with or confirm it with their armband. Then I'm just going to explain what the procedure is that I'm doing. So, beginning at the head, there are no lesions, no cuts, no scrapes, no bruises. The hair is thin, but yeah. The face is bilaterally symmetrical. So now I'm going to be checking their pupils. So you want their pupils to be equal, round, reactive to light. So, their pupils are equal, round, and reactive to light. And I'm going to perform accommodation. So I'm gonna have the patient look straight ahead, and their eyes should cross or come closer together, and that means they are accommodating. So one thing that I forgot to ask the patient was, um, I forgot to ask them their orientation. So, are so, do you know where you are today? Yes. And do you know the dates? And do you know the time? Perfect. Thank you. So now that I got that out of the way, I am going to continue on with my neurological assessment. So I'm going to have the patient pull me away from them and pull me towards them. I'm also going to check cranial nerves number 5 and 7. So to check cranial nerve number 5, I'm going to have a patient smile. I'm going to have them stick out their tongue, um, puff out their cheeks. And then for cranial nerve number 7, I'm going to place an object on both sides of the client's face, and I'm going to ask them to tell me when they feel the object on their face. So moving on, I'm going to listen to the cardiac sounds, or I'm going to listen to the apical pulse, which is the point of maximal impulse. So that's right here at the fifth intercostal space, mid-clavicular line, and I'm going to listen here for 1 full minute. Now, I'm going to listen to the lung sounds. I'm going to listen to the four anterior sounds, and then 2 lateral sounds. And then the same thing on the back. I'm going to listen to the four posterior sounds and then the 2 lateral sounds. Next, I'm going to inspect the abdomen. So, looking for any curvature or distension of the abdomen, which my patient has none of. So, now I'm going to auscultate, starting with the left lower abdomen. So, moving clockwise. And now I'm going to palpate in circular motions, feeling for any tenderness or pain in the abdomen, which my client has none of. Now I'm going to move on to the legs. The skin on the legs is warm, but not hot, nor cold, nor clammy. It's a little pink, but not flushed or red. The skin is a little bit dry. So what I'm going to do, I'm going to ask the patient to press against my hands, and I'm going to have the patient extend their or point their toes to their nose. And I'm also going to check for capillary refills. And also on the feet, I'm going to check for their dorsalis pedis pulses and their posterior tibial pulses, which all pulses should be strong but not pounding nor thready. Yep, that's my video. Thank you.